Good evening and thank you for joining us. There's a dire new warning tonight about where COVID-19 is headed in Canada. New modeling suggests the virus is surging just about everywhere, and there's an urgent need to bend the curve. An increase in community spread is leading to more and larger outbreaks. Health officials predict by Christmas, Canada could see a total of 577,000 cases and close to 15,000 deaths. The country is on a rapid growth trajectory. If we maintain our current number of contacts, the epidemic will resurge. If we reduce our contacts to only essential activities, we could get the virus under control.
There is no other way. We must reduce our in-person contacts right now. A vaccine in a week or in a month won't help you if you get COVID-19 today. So my message to Canadians is simple. Hold tight and don't give up.
As David Akin reports, health officials say without more stringent measures, Canadians will have a tough time stopping the spread.
COVID-19 is still presenting a very clear danger to Canadians all across the country.
On the eve of the first COVID-19 vaccines arriving in Canada, a reality check about the current COVID-19 crisis.
Folks, the situation is still very, very serious. We're still battling the second wave.
Canada is seeing about 6,500 new COVID-19 cases a day. Hospitals in many parts of the country cannot keep up. And on Friday, a new warning that daily case count could climb past 12,000 by January.
And there's little indication this upward trajectory will change without further intensifying public health measures.
The main problem, the 6 provinces west of Atlantic Canada. And while measures taken 2 weeks ago in BC and Manitoba are starting to have an effect, more may have to be done in all provinces.
Knowing access to safe and effective vaccines for all Canadians is within sight might lead some to think COVID-19 is no longer a problem. But the reality is very different.
Ontario got the message. On Friday, it announced new lockdowns and tighter restrictions for several regions in the province.
As we begin to roll out vaccines, we can't take anything for granted. Please keep up the fight. Make sure we social distance, wear a mask, wash your hands.
Ontario also sketched out its vaccine rollout plan, a rollout that will be quarterbacked by Rick Hillier, Canada's former Chief of Defence Staff, and will begin at hospitals in Toronto and Ottawa.
What we're starting with is moving those healthcare workers and the essential visitors from those long-term care homes to the vaccination sites. And as one of the doctors said to me, by doing that alone, we'll improve the protection of the residents in that long-term care home by 90+% because the COVID-19 enters the home through those people.
But getting the Pfizer-BioNTech vaccine in place over the weekend will be a massive and complex logistical operation, one that federal, provincial, and healthcare partners practiced during a dry run on Friday. David Akin, Global News, Ottawa.